Hi, class. It's Dr. Linder. We're still on connective tissue. So remember, with connective tissue, we have a few categories. We have connective tissue proper, supporting connective tissue, and fluid connective tissue. Let's take a look here at fluid connective tissue, which is blood. Let's just do a little review about blood. Blood temperature is between 100 and 100.5 degrees. The pH of blood ranges between 7.35 and 7.45. So we're looking at an average of about 7.4, which means that the pH of blood is slightly alkalinic. Remember, the pH scale goes from 0 to 14. Right in the middle is 7. So 7.4 is right there. It's slightly alkalinic. Anything on this side is an acid. Anything on this side is an alkaline or a base. Stomach pH with hydrochloric acid is here. It's 2.3. And every body tissue has a different pH. pH stands for potential hydrogen or percentage hydrogen. And the more hydrogen there is, the more acidic. The less hydrogen or the more hydroxide, the more alkalinic. So the more hydrogens, you're acidic, and the more hydroxides, the more alkalinic or basic. The blood volume for males is about 5 to 6 liters, and females 4 to 5 liters. If one eats too much salt, or you have too much salt in your diet, then one can retain more water in the blood vessels. When you have increased blood volume, that increases blood pressure. So what many people do when they're retaining water is they use a diuretic. The diuretic gets rid of excess water to decrease pressure. Diuretics like Lasix, they certainly have their complications because wherever water goes, minerals go. If you lose water, you're going to lose magnesium, you're going to lose potassium. When you lose these minerals, you lose electrolytes. It can affect the heart rate, the heart rhythm, and the electrical conduction. And many people who use these diuretics have died just on the spot of something called ventricular ectopy. Ventricular ectopy. So you have to be very, very careful with certain medications. When we look at blood, blood is connective tissue. Remember, connective tissue, you have cells and you have matrix. So 55% of the blood volume is plasma, and the plasma is matrix. What makes up the matrix? We have 91.5% water, 7% protein, and 1.5% solutes. The other 45% are the cells. Those are the formed element, the red blood cells and the white blood cells. The red blood cells, really not the best term for it because most cells have a nucleus, and a red blood cell does not have a nucleus. Why doesn't a red blood cell have a nucleus? If you think of a cell and you think of a nucleus is a pretty large organelle. If a red blood cell had this huge nucleus in it, then there wouldn't be any space to carry the oxygen. And the main function of red blood cells is to carry hemoglobin so that the iron of the hemoglobin can bind to oxygen. Okay? So that's why red blood cells do not contain a nucleus. A red blood cell does not use the oxygen that it's carrying to make ATP. So all of the oxygen that it's carrying, all of it, it delivers to the lungs. So meaning the red blood cell can go to the lung, pick up oxygen, drive that oxygen to all the other cells and tissues of the body, and then bring that red blood cell back to the lungs to pick up more oxygen so that it can deliver it to other parts of the body. How does the red blood cell pick up oxygen at the lung? Well, the pH of the lung is alkalinic or basic, so the hemoglobin can connect to it. And as you move further away from the lungs into other tissues, it becomes more acidic. And the red blood cell releases that oxygen in a more acidic environment. Okay. And the term for that is called the Bohr effect. The Bohr effect is the effect between the acid and the base, knowing when the red blood cell should hold on to oxygen and when it should dump it or deliver it. So here we're looking at the plasma. That's the extracellular matrix. That makes up the 55% of the blood, and the other 45% of the formed elements, the red blood cell, the white blood cell, and the platelets. Okay, the red blood cell is called an erythrocyte. The WBC, or the white blood cell, is called a leukocyte. And then we have cell fragments called platelets. The platelets are involved with clotting. So it helps us clot. The white blood cells are involved with immune function. And the red blood cell carries oxygen, CO2, and even nitric oxide. Nitric oxide helps to vasodilate blood vessels, which means to open up blood vessels. When we look at the different types of white blood cells, we have granular sites and agranular sites. So what we have here on the right side are granulocytes, and on the left side, if you put the letter A in front of that, it's agranular sites. What that means is the granular sites, look at the cytoplasm, we have granules here. When you look at the left side, the cytoplasm is smooth, it doesn't have any granules, so they're agranular sites. The granular sites degranulate to break down foreign particles as part of the immune system to help defend yourself. So the basophil, eosinophil, and neutrophil, these are granular sites. Your neutrophil, if you look at the nucleus, it has anywhere from 3 to 5 heads to the nucleus, whereas the eosinophil is bilobed. It just has 2 lobes to it, 1, 2. And the basophil, you see, is obscured. The nucleus is obscured. It's hard to find because of these dark bluish, blackish staining granules. The eosinophil, the cytoplasm typically stains red. It's an acidic stain. The basophil is basic. It stains blue. And the neutrophil is neutral. So if you see bilobe nucleus, it's an eosinophil. If you see 3 to 5 heads to the nucleus with granulations, it's a neutrophil. If it's bilobed, it's an eosinophil. And if the nucleus is kind of S-shaped and it's obscured and hard to see with dark blue staining granules, it's a basophil. If the neutrophil count is high, you have a bacterial infection. If the lymphocyte count is high, you have a viral infection. If the eosinophil count is high, it's usually a result of allergies or parasites. Okay, the eosinophil makes histamine. The basophil can make histamine ACE. So as the eosinophils are high in making histamine, and we know when someone's having a lot of histamine, they have allergies, the basophil is making histamine ACE to try and to kind of keep it in check, if you would, okay? Neutrophil is high, bacterial issue. Lymphocytes being high, you have a viral issue. A little mnemonic for that is never bet Las Vegas, never bet Las Vegas. Neutrophil, bacterial issue. Lymphocyte, viral issues. Easy way to remember that. Monocyte, pretty large cell. If you look at the nucleus, it's kind of kidney bean shaped. Monocytes become macrophages, and those are phagocytic. So monocytes are always in circulation, but when they find an issue deep in the tissues, the monocytes dive deep, they invade the tissue, they turn into macrophages, and they become phagocytic. Platelets are really involved with clotting. When people use aspirin, they block these from working. And if you can't clot, then your blood becomes thin. These are people that bruise very easily, and when they cut, they bleed very, very easily. How do we keep the blood circulating? There's a lot of different things that can help circulate blood. Just movement and exercise, any type of muscle, skeletal muscle contraction helps with the pumping of blood. Diaphragmatic movement, so respiratory movements, help to circulate blood. Manual therapy or massage therapy helps to circulate blood. B vitamins, especially niacin, can keep the blood thin. That's why when people take niacin, sometimes they flush and their cheeks turn very, very red. The omega-3s help to thin the blood. Garlic helps to thin the blood. We got garlic. We got vitamin E can thin the blood. Red wine or resveratrol can thin the blood. There's so many things. I wouldn't do all of these things, but I've had patients who I've put on 4,000 milligrams of omega-3s, right? Because they have anti-inflammatory effect. And because they knew 4,000 milligrams had anti-inflammatory effects, this individual doubled it and took 8,000 milligrams. I saw them 2 to 3 weeks later, and they had black and blues on their shin, and they don't know how it happened. And I asked if they were taking any medications. They said no. I said, did you bang yourself? She said, I could be. I don't remember. I said, are you taking any different vitamins or nutraceuticals? She said no. I said, did you change the dosage of any of them? And that's where I got the yes. So this is why many surgeons, when they do surgery, they'll tell you, stop all of your medications, stop all of your vitamins and nutraceuticals. And it's because there was one person post-surgically that couldn't clot, and this individual was on very, very high dose omega-3s. Now, low doses of 2,000 and 4,000 isn't going to create blood thinning and bruising and bleeding, but high dosages certainly can. So out of being overly cautious, they simply tell everyone, just stop all your vitamins, stop all supplementation a few days prior to any type of surgery, because you need to be able to clot post-surgery.